So, treatments and side effects. The first treatment I had was a combination of 3 very strong drugs. These drugs, I had to have some further testing done to make sure my body could withstand the drug. And this treatment was 3 weeks out of the 4 weeks in the month, and I would have 1 week off. I would go down to U of M, where I've had most of my treatments, and I would get pumped with all these fluids, and then sometimes I would come home with a pack attached in a fanny pack of chemotherapy drugs that would pump all night long. Some side effects I had from this is, obviously, I lost my hair the first time. I had neuropathy in my fingers and toes, which means you can't feel them. They kind of go numb. With that, chemotherapy also cuts back on the circulation in your body. So my toes and my fingers were black for about 9 months after I had the treatment even. And I lost some hearing in my left ear. I blame a lot of the times when I don't answer people because I'm not paying attention because I lost some hearing during my chemo, but most likely it's just because I'm not paying attention. But I really did lose some hearing in that ear. I could probably benefit from having a hearing aid in the future, but right now I'm okay with it. I just usually try to stand on the right side of people because I can hear perfectly fine out of that side of the ear. The next treatment I had was another chemotherapy treatment, and I did that one for 6 months. I was supposed to do it for 9 months, but again, it was being too toxic to my body, and I had to stop early. I think this has a lot to do with the size of me. I'm very small person. I've had scans done on pediatric scanners at U of M because I could fit in there easier than some adults, and that way I could get my scans done faster. I also had some side effects from this drug. I lost my hair with this one. I had the neuropathy again, and I lost some of my vision. My prescription was double the time when I went back 6 months after I had the treatment. And this treatment I thought was just going to be so easy because it was 1 week at the hospital and 3 weeks off. And I did this while I was attending school, so that may have made a difference. But I was doing school and an internship, so it kind of just wore me down a little more. I was just really tired. And before that, I had lost 90 pounds in 3 months, so I wasn't really healthy to begin with. So I think that had a really big side effect on it because I was really sick the second time compared to the first time where I was kind of just easygoing, would be sick for a couple days like I had the flu, but then I would be up and going the next day. The next type of treatment I had was radiation. So the second chemotherapy I had was to shrink the tumor in my pelvis, Horace. And when I went through that treatment, the tumor started shrinking really fast. I could notice a difference instantly because the tumor was so large that it had actually killed my muscle in my butt, so I didn't have a butt cheek on the right side, and it had compressed my sciatic nerve, so I had paralysis of my entire right leg from my crotch down for about 9 months, and I still have paralysis of my right leg, but it's gotten so much better that I can only not feel the bottom and the top of my foot now, which led me to having to wear a brace for 9 months because of the foot drop and not being able to control my muscles. And after I had that chemotherapy, the tumor was still pretty large. It was still 20 centimeters in diameter, so it wasn't quite the size they wanted it to be. So I went to radiation, where I had radiation for 90 radiation treatments, which burned my skin. My skin peeled, but it did shrink the tumor. And the tumor is not visible anymore, and I have my muscle back, which is amazing. And it really helped, except that my skin on my stomach and on the side of my body was just totally raw and very uncomfortable. After that, I had a scan done, and I found out that I had some more tumors. That's when I found out I had the rib cage tumor. And because it was only a couple months after I had chemotherapy, they decided to send me to radiation again. And when that scan came back, it actually showed that my pelvis tumor was even smaller, which they hadn't expected it to be smaller at all. And it's almost completely gone. You can't feel it on my spine or on my bones anymore. And they thought, okay, we're going to give her radiation for the tumor on her back. Well, I had radiation there for 30 treatments of radiation, and that burned my skin so extremely bad that my skin was burned for about 3 months after that. And I already have a latex allergy, so I couldn't put any dressings on it because it would make it worse. And I have an adhesive allergy too, so I can't use Band-Aids or anything like that. So I just had this open wound on the side of my body, right under my armpit, from the radiation. I then found out that I had more tumors when probably back in November. It seems like November is the time I usually find out that I have to go through some treatment or something, but the doctors had discussed that I need to go on chemotherapy again, and I only had 1 semester left of school, so we talked it over, and I'm doing an oral medication right now, which I take every day. I take a pill in the morning and 2 pills at night. It doesn't cause you to lose your hair. It is, however, a liver cancer drug, so I have to get blood tests done every 2 weeks to make sure my liver is functioning properly. It does give you very bad sores. Oh, with the other chemotherapy drugs, you also get mouth sores and throat sores, which are like canker sores in your mouth and down your throat, and you can also get them in your private areas if you're a girl, so lucky me. Anyways, so this chemo that I'm on right now, the oral one, it gives you blisters on your body. I have some blisters. You can see them in between my tattoos. They're very painful. I have them all over the backs of my legs. I have them on my stomach area. But not only does it give you blisters, but it also causes the bottoms of your feet to peel very badly. So I'll get blisters, and then it will peel, and then I'll get a blister underneath the new skin. So it's almost hard to walk sometimes. And again, I thought, this is going to be a walk in the park. Just take some pills every day and you'll be fine. Not the case. This is by far the hardest chemo treatment I've gone through with the most side effects. And I hope when I get my scans in a couple weeks it's working out so I don't have to do another IV.